Hey everybody, so in today's video we are going to be diving into some specific behaviors that parents that have children with autism may notice. Some of these behaviors may include excitement tremors, side glaring or up gaze, and even hand posturing. It's important to note that autism can bring a wide range of behaviors that basically reflect how the child is interacting with their world. To some of us who may not understand, when we see these behaviors, we may think of them as unusual or strange, but in reality, these behaviors actually serve a purpose. So let's talk about a few of these behaviors that may have you questioning what's going on and why is my child doing this and what should I do about it. So the first behavior that I want to briefly talk about is excitement tremors. So if you've ever seen a child tense up their bodies and shake really intensely, that is what is known as an excitement tremor. And often this type of excitement tremor happens because a child has an overload or a sense of heightened emotions, and it comes out in their bodies. So if you see your child engaging in these excitement tremors, typically it's nothing to be worried about. It's basically just your child's nervous system responding to what is going on in your child's outer world. And if your child is overwhelmed with joy or excitement, then you may start to see some small tremors or some of those shaking movements. The next two behaviors that you may see often deal with the eyes. So you may see a child engaging in what's known as up gaze, and that is kind of when the child's head is tilted down and their eyes are looking straight up, and they're not really focusing on anything in particular, but you do see that their eyes are risen up to the very top and it seems like they're staring very intensely. Or you may see something known as side glaring, and that is often when the child is looking really intensely out of the side or corner of their eye. So if you see the up gaze or the side glaring behaviors, they are typically done for a variety of reasons, but we'll just touch on a few of them. One of the reasons that a child may be engaging in these type of behaviors is because they may be seeking increased visual sensory input. Another reason why your child may be engaging in upgazing or side glaring is because they are trying to process information and make them feel a little bit more comfortable. So when they look up or look to the side, sometimes that may be a little less intense for them and a lot more comfortable for them rather than looking at something straight on. It's kind of like the same reason why you may notice a lot of children with autism, not all, but some children with autism avoid eye contact because looking directly in someone's eyes for them may be too much intensity and it becomes overwhelming for them. So that's why they may avoid that eye contact altogether. So it's kind of like the same thing with the side glaring or the up gaze. They may be processing information and just trying to eliminate a lot of that visual input and trying to minimize what they're actually focused on or looking at. Another reason why your child may be engaging in upgazing or side glaring is because it's regulating to them. Sometimes when a child is intensely using their eyes to look to the side of their face or look up, it's creating a lot of intense input to their bodies and to their visual sense. And for some children, this may be very calming and very regulating to them. So that could be another reason why your child is engaging in those type of behaviors. Another behavior that you may consider unusual or you may not be sure what's going on, why is my child doing this, is something called hand posturing. Hand posturing is basically repetitive movements with the child's hands and fingers. And hand posturing can look like a variety of different things. Some of us have seen the posturing of the hand flapping. Some of us may have seen hand stiffening where the child holds their hands out in front of their face and holds their hands really stiff in a set position for a long period of time and kind of observe and look at their fingers. There's also hand posturing that is associated with wringing of the fingers, with finger flicking, with hand tapping. Some of you may also see things like hand clasping where your child keeps their hands closed like this. Some may engage in intense clapping like this. Others may engage in intense rubbing. So all of those things are known as hand posturing. And once again, these are done for a particular reason and they have a purpose. Some children may use hand posturing as a coping mechanism. Some use it for self-regulation. Some use it for sensory exploration. So there could be so many reasons why your child is engaging in that behavior as well. Other behaviors that you may see may include things such as pinching. I've heard so many parents tell me sometimes their child will come sit next to them, like while they're on the couch, they'll bury their face next to them, and then they'll just kind of really softly like pinch the skin on their elbow, right? I've heard of other parents telling me about like kissing behaviors where their child will kind of gently kiss them multiple times. Sometimes it's for affection, sometimes it could be seeking some sensory feedback. There's also behaviors such as facial pressing, where your child will basically bury their face next to you, whether it's into your face or into the side of your body, and kind of like rub as intensely as they possibly can. Another behavior that you may see is that some children may have a focused look where it seems like they're really intensely looking at something, but they're kind of like holding their breath at the same time, right? So all of these behaviors, you may be like, oh my gosh, why is my child doing these things? And all of them, whether it's the hand posturing, whether it is the side glaring, the up gazing, whether it is the excitement tremors or the skin pinching or the facial burying, all of that has a purpose. So never forget that, right? And just as a recap, some of those purposes may be related to just sensory exploration. Some of them just need more intense sensory input. Some of them engage in these behaviors to help them feel more calm, feel more regulated. Some of these children engage in these behaviors because they are seeking comfort, or they're trying to just learn more about their environment, and they use their bodies as a way of learning about their environment. Some children do these things because it just helps them feel more grounded, more relaxed. And other children may do it because they are just trying to figure out some more information about their sensory needs. So I know if you've been watching the video up to this far and you are like, yes, this resonates with me, I see my child engage in this behaviors like quite often, you're probably wondering like, okay, so as a parent, what should I do about it? Or how do I navigate this? Like when my child does these things, like what should I do, right? So I have 4 main things that you should think about or you should do when you do see your child engaging in these behaviors, right? So number 1, I recommend that you validate their experience. So what I mean by validating their experience is that you learn to acknowledge what they may be feeling or what they may be going through, and maybe even why they're doing what they're doing. So for example, if you see that your child is like pressing their face really intensely against you, you may say something like, oh wow, I see that you're excited. Do you need a hug? Do you need a squeeze? Because if you've noticed that when my child like really seeks intense input, that is a behavior that they do, they kind of press their face into mine, then that may be a sign that your child is just seeking more intense input. So offering them a tight hug or offering them some squeezes to the body may help them feel more regulated if that is what they're seeking. Or another example could be if you notice that your child is like constantly like pinching the skin on your elbow, you may start to recognize like, is this comforting for my child, or are they seeking more input to their hands? If so, you can always offer them things like Play-Doh or putty, or let's do a sensory bend where they're using their hands if that is the type of input that they're seeking and if they are seeking more of that comfort. So like I said, if you do see it, just acknowledge what they're doing, just validate what they're doing, and if necessary, you can offer them additional sensory supports or other supports that will coincide with exactly what they're seeking. Which brings me to tip number 2. If you see your child engage in these behaviors, make sure you are giving them the appropriate sensory inputs that they need throughout their day. So if you notice that your child is engaging in a lot of these like behaviors, right? Whether it is the hand tapping, the intense hand rubbing, the facial pressing, if you're seeing all of these behaviors on a consistent, regular basis, it may just be a sign that your child needs a little bit more sensory input to help them feel more calm, help them feel more grounded, help them feel more regulated. So you may offer things throughout their day like deep pressure techniques. So that could be things like hugs, that could be things like massage, joint compressions, weighted vests, compression garments underneath their clothes, things that really just kind of help them feel more grounded. You may also offer more movement-based activities such as obstacle courses. You may offer heavy work opportunities. So heavy work is basically anything that your child is involved in where they're really using their muscles, right? So they may be carrying weighted objects, they may be pushing, pulling, lifting heavy objects, and that will also help them with that regulation piece. You may also offer them like fidget tools, right? So things that they can play and manipulate with in their hands. So just take note of how often your child is engaging in these behaviors and just try to implement more sensory input and see if that helps your child as well. A third piece of advice for you, if you see your child engaging in these behaviors, is to try to understand that if it's not sensory related, is it more associated with your child being anxious or overwhelmed or overstimulated? And if you notice that your child is very anxious or easily stimulated or very sensitive, then they may be engaging in some of those behaviors to kind of help them cope, right? So one thing that I recommend for that is to offer more structure and routine throughout their day. When you offer more structure and routine, it helps children with knowing what to expect, which will lead to less anxiety and feelings of being less overwhelmed. So some ways that you can do that is offering your child a visual schedule so they can know like what to expect throughout their day. You can read to them like social stories so that when they are involved in certain situations or activities or go to new environments, they kind of have an expectation of like what to expect. Also, you can offer things like first then boards. So just knowing like, okay, first we're gonna have dinner and then we're gonna go take a bath, so that they know what's coming first, what's coming second. And often when your child has a better understanding of what to expect, this will help with some of that anxiety and those feelings of overwhelm, and you may see a decrease in some of those behaviors that your child has been engaging in to help them cope. And tip number 4, which I think is probably one of the most important tips, is to just create a safe space and allow them to engage in these behaviors. Because remember, as we've been talking about through this whole video, they do serve a purpose. You do not have to necessarily stop them from engaging in these behaviors. You don't have to interrupt the behaviors. You don't really even have to redirect these behaviors. Allow your child time and space to engage in these behaviors to help them self-regulate, if that is how they self-regulate. Remember, these behaviors are typically harmless. It's not hurting anyone to let these children engage in these behaviors. Now, on the flip side of that, the only time I would advise you to redirect these behaviors or try to intervene with these behaviors is if, one, it is a safety concern. So if it's putting the child at risk of harm or injury, then that is when I definitely would recommend that you step in and try to redirect that behavior. So let me give you a practical example, right? So if you see that your child is engaging in some of that side glaring, right, where they're staring intensely out of the side of their eyes, right? You see them engaging in that side glaring and they are getting very close to the stairs or very close to the street. Obviously, you're not going to let your child continue side glaring when the stairs are right in front of them, right? You are going to want to redirect that behavior, redirect their attention to those stairs so that they can see and be safe as they're walking down the stairs. Or if they're getting too close to the street because they're not really paying attention, they're side glaring, then that is when you can redirect their attention and try to refocus their eyes to the street to let them know like that is not safe, okay? The second reason why you may want to intervene or redirect the behaviors that you're seeing is if it is disrupting that child's ability to engage with their daily routines. So if it's impacting their ability to eat or dress themselves or complete a specific activity that they need to complete, then that is when it is appropriate to try to redirect that behavior. The third reason why I would say it's okay sometimes to redirect or intervene with those behaviors is if it is preventing them from engaging in a learning experience, or if it's disrupting like a family routine or a social interaction, then that is a reason why you may want to intervene or redirect the behaviors. The fourth reason why I say sometimes it may be okay to redirect those behaviors is if you notice that the more they engage in those behaviors, the more distress that they're under. Sometimes increased involvement with some of those behaviors may actually lead to more overwhelm and more distress rather than more regulation. So if you notice that that's the case, then you may want to provide them with alternate ways to kind of help with that regulation piece and with that anxiety and stress component. So remember, there are ways to gently intervene with these behaviors, but only if necessary. You do not need to stop these behaviors or intervene with these behaviors because you are feeling embarrassed by them, or you are like, oh gosh, what's somebody else gonna say about my child, or what's somebody else gonna think about me. Like, those are not legit reasons why you should be stopping these behaviors, because you don't want to oppose what your child actually needs. But if you do need to redirect them, right, you can provide gentle guidance, you can provide additional sensory supports, you can provide breaks as needed, only if it serves a purpose and it's more safe for your child than not. So what's most important is we have to remember that every child is different, because every person and every human on this earth is different. So it's our job to meet these children where they are. So if you are a parent out there and these are some of the things that you have been struggling with, remember to just give yourself patience, seek out the supports that you need, give your child the supports and the grace that they need, and give yourself grace as well. And if you notice that your child engages in a lot of these behaviors when you're out in public and sometimes it makes you feel embarrassed or ashamed, then definitely stick around and watch this next video. Now, the next video is not necessarily about these particular behaviors being done in public, but it's done about how to not feel embarrassed when your child is throwing a tantrum in public, but the same rules apply. It's basically all about how to not feel embarrassed in general when you're out in public and your child does these behaviors that you consider kind of unusual, okay? So watch that video next, and I'll see you guys in the next one. Bye.